Hello, dear viewer. I'm Dr. Kim Langdon, advisor to CCM Health, and I'm here today to do an educational presentation on diabetes. I hope you'll find it very informative. A little bit about me. I'm a retired board-certified OBGYN with 19 years of clinical experience. I went to medical school at The Ohio State University College of Medicine. I then went on to complete my residency there as well. Afterwards, I went on to clinical practice, and now I'm currently the founder and chief scientific officer for Coologics, which is a part of my inventions. I've invented 6 medical devices, 2 of which are patented. So I'm working on that project as well as doing health education in my part-time. So today we're talking about diabetes. There's 2 types of diabetes. Type 1 is mostly genetic. You're born with it and usually manifests in childhood and young teenagers. It accounts for 10% of all people with diabetes. These people are insulin dependent once they reach that diagnosis. Type 2 is far more common. It accounts for almost 80% of cases of diabetes, tends to happen in middle age and later, and it's strongly related to obesity. People often can manage this with diet, but if not, then usually medications, and sometimes insulin is required as well. Secondary diabetes refers to elevated glucoses from another medical condition. Things like chronic pancreatitis, that can be due to excessive alcohol or medications, trauma, surgical removal of the pancreas can cause secondary diabetes. Hormonal disturbances can do this as well, primarily those that arise out of the adrenal glands, which can cause excess growth hormone or excess steroid secretion. There are some medications, primarily steroids, such as prednisone, something that is commonly prescribed for people with breathing difficulties and asthma. As we talked about, type 1 is primarily genetic. It's considered an autoimmune disease, and it tends to run in families. Whereas type 2 has to do with, poor health choices that lead to obesity, inactivity, other medical conditions like high blood pressure and high triglycerides can cause diabetes as a secondary type 2. When you want to know where you stand, to be diagnosed with diabetes, your fasting glucose should be 126 or higher. If it's between 100 and 125, it's considered pre-diabetes, and normal, of course, is anything under 100. Fasting is usually 1 hour, fasting is usually 8 hours of nothing to drink or eat. So again, here are the risk factors we pretty much covered. With regard to pre-diabetes, there's not really any obvious symptoms. Whereas with type 1 diabetes, it usually manifests fairly significantly with increased hunger, increased thirst, frequent urination, fatigue, weight loss, blurred vision, even mood changes. Type 2 isn't as acute. The symptoms may be more gradual and subtle, but you can have slow healing sores, darkened skin in some areas of the body. So the best thing to do if you're at risk for prediabetes, or your doctor has warned you that you have prediabetes, is to try to lose some weight, eat more whole grains and vegetables, more fiber, and try to get at least 5 days a week of 30 minutes of exercise every week. Brisk walking is fine. Anything else is a benefit as well. When you have type 1 diabetes, of course, the treatment is insulin therapy. And you need to check your blood sugar levels quite frequently, usually when you wake up or before meals, and then usually 1 to 2 hours after meals to see what your insulin doses should be adjusted to. And if you have type 2, again, it's the same thing: lose weight, diet, exercise, monitor your sugars, and sometimes you have to be placed on medication, and rarely insulin must be added as well. So let's talk about A1C and fasting plasma glucose. That's the FPG, and then the oral glucose tolerance test. A1C is a measurement that we use to measure the amount of glucose on your hemoglobin, on your red blood cells. So the normal is less than 5.7%. Prediabetes is 5.7 to 6.4%, and anything over 6.5 is considered, an elevated, and you're likely diagnosed with diabetes at that point. And we already talked about the fasting plasma glucose. One way to ensure the diagnosis is do what's called an oral glucose tolerance test. And that's where you're given something to drink that has a specific amount of glucose, and then your plasma glucose level is measured afterwards. And anything under 140 is normal. And then anything from 140 to 200 is considered prediabetes. And of course, over 200, and you have diabetes. So again, I already spoke about hemoglobin A1C. It's also called glycosylated hemoglobin. It really is important because it can measure the past 3 months levels of glucose in your blood. So it sort of is a measurement of how severe your diabetes is, or it's a measure of how well you're controlled with your medications. Different, associations have different cutoffs, but the goal is to keep it under 7.0%, and sometimes under 6% is recommended. Here you go as far as what you might correlate a level of the hemoglobin A1C, what that would mean with regard to your mean blood sugar. 6 would mean, 135, which is good. 7 would be correlate with 170 blood glucose. 8 would be 205. And as you can see, it goes up quite rapidly as your hemoglobin A1C doubles. So hypo and hyper. So hypo means low, or less blood sugar. You can have too low of glucose in your blood, and that's generally anything under 70 milligrams per deciliter. Hyperglycemia is considered over 200. Complications of diabetes are, can be significant. Cardiovascular disease is more common in people with diabetes, and people with diabetes tend to have unusual symptoms, or their symptoms can be missed more easily because of the nerve damage that I'll talk about in a minute. But coronary artery disease can lead to angina or chest pain, which can lead to heart attacks, stroke. All of this is worsened if you have narrowing of the arteries from atherosclerosis. Neuropathies are nerve damage, and because of excess glucose is inflammatory, it can damage the walls of the tiny blood vessels that nourish your nerves, especially in your legs. So you can get tingling, numbness, burning pain in your fingers, your toes, and your feet. And this nerve damage that affects your feet can affect the blood flow to your feet as well. So any minor cuts and bruises can develop into blisters and serious infections. So that's one of the common complications of, damaged nerves and blood vessels is unhealing sores and ulcers that cannot be taken care of with routine antibiotics. As we talked about skin conditions, you'd be more prone to fungal infections or yeast infections. Because hearing depends on the nerves, you can have hearing complications. Same with the eyes. That is called a retinopathy, when the blood vessels in the retina become damaged, and this can lead to blindness. So you will often be asked to get your hearing and eyes checked frequently. And because diabetes can also narrow the blood vessels in your brain, Alzheimer's appears to be increased in people with diabetes, as is depression, because depression originates in the brain. So any decreased blood flow can impact that, as can any chronic medical condition make you prone to depression. So here we sort of talk about the major complications from, a microvascular, so those vascular, I should say, which basically is the small blood vessels, the little capillaries in your eyes, kidneys. If you get kidney damage, you can end up on dialysis and have kidney failure. And this is primarily due to the inflammatory nature of glucose, as well as high blood pressure. As stated before, your neuropathy can occur because of high blood glucose and the retinopathy. Then we have the macrovascular, so larger blood vessels that supply our brain and heart and our extremities. When they're compromised, then you can have a stroke, you could have a heart attack, or you could have decreased blood flow to your extremities, which again can lead to infection and amputations. Bacterial infections such as styes of the eyes, boils, folliculitis, anything that affects the toenails or fingernails can get fungal infections. So those can be cleared up with antibiotics. Fungal infections are most commonly caused by Candida albicans. Fungal infections are also known as yeast infections, unless they get in your blood, and then they're called fungal blood infections. But they can cause itching, burning, blistering, redness, oozing, and this can happen in the genitals, the armpits, or the groin. And again, topical and oral antifungal drugs can help cure those. Itching, of course, can be from a yeast infection, but it's also due to dry skin and poor circulation. So it's best to, keep all body parts clean and dry and moisturized so that you limit the itching, because if you scratch, you can break open the skin, which could lead to an infection. Something called acanthosis nigricans is when you have tan or brown raised areas on the sides of the neck, armpits, or groin. The best thing you can do is lose weight and to lessen the appearance. Sometimes creams can help make the spots, the areas, less dark. Dermopathies are caused by changes in the small blood vessels, and they're like light brown scaly patches. They're oval and circular. Sometimes they are confused with age spots, but they don't hurt or do anything, so really nothing is needed. And then, of course, anybody can have an allergic reaction to a medication, including insulin or diabetes. So if you ever take a medication and you experience itching, hives, swelling, shortness of breath, that could indicate an allergic reaction and can be an emergency. So if you're not sure, contact your doctor. Eruptive xanthomatosis is another condition when your diabetes is out of control and you can get these firm, yellow, pea-like enlargements of the skin. It could have a little red halo around it and it might itch. It usually occurs in young men who have type 1 diabetes. Trying to control your glucose better can help alleviate these problems. Digital sclerosis is when you develop tight, thick, waxy skin on the backs of your hands or your toes or your forehead. Finger joints can become stiff. And the only thing you can really do about it is try to control your blood glucose better. Retinopathy, which again refers to disease of the eye, you can get glaucoma. So people with diabetes are 40% more likely to suffer from glaucoma than people without diabetes, and that risk increases with age. There are treatments for glaucoma. Sometimes drugs are used, sometimes surgery. Cataracts, people with diabetes are 60% more likely to develop this eye condition, and it might happen at a younger age and progress more quickly. It causes the lens to cloud up, blocking the light. And people with this need to wear sunglasses to prevent the glare. You can get a transplanted lens, but it's best to have your glucose well controlled to prevent these problems rather than try to treat them after they occur. Some of these conditions are irreversible. There's just different staging ways that eye doctors describe retinopathy. Obviously, proliferative is worse than non-proliferative. And if the macula swells with fluid, that must be treated. Nerve damage is also known as neuropathy. Peripheral neuropathy is mainly the tingling and burning and weird sensations in your extremities, your hands, fingers, feet, and lower ankles. You can have increased pain or increased sensitivity or have shooting pains in your feet. A lot of unusual sensations that have been described, like you can feel like even though your hands aren't hot, they might feel hot or feel very cold when in fact it's warm out. You could get weakness in the muscles of the feet and lower legs. So you need to be aware of that. It's best that this is managed with better glucose regulation. Of course, the pain can be managed And sometimes antidepressant drugs are helpful in controlling neuropathies. Autonomic neuropathy affects the autonomic nerves. Well, what are those? Those are nerves that control the organs like the bladder, intestines, and other internal organs. So if the nerves to your intestinal tract, are damaged, then you can have gastrointestinal symptoms like indigestion, heartburn, vomiting, bloated, diarrhea, constipation, or you could have frequent urination, or you might get a full bladder and not know you have a full bladder because you can't sense it. And that can lead to loss of bladder control and frequent UTIs. Erection problems may be actually one of your first signs of diabetes or an undiagnosed high blood pressure. You can get dizzy or faint after changing position if the neuropathies affect your blood vessels. And as we spoke about your eyes, you can get retinopathy, which makes it difficult to drive at night. You might notice increased sweating at night or when you're eating. And then sometimes you don't even have any symptoms that you have a low blood sugar because of this nerve damage. Charcot joint is neuropathic arthropathy. It occurs when a joint breaks down because of the nerve supply to it. It's most often found in the feet and ankles. So you may have difficulty with walking. You can get neuropathies of the cranial nerves, such as the nerves that supply the eyes, the ears, and the taste buds. And even sometimes you can get face pain from the neuropathy to your eye. You can get carpal tunnel syndrome, which is a compression kind of mononeuropathy. People without diabetes can get this as well, but it might worsen as your diabetes worsens. Femoral neuropathy is the femoral nerve supplies the thigh. So you may get muscle weakness to your thigh, even though you might not have any pain. So kidney disease is one of a very dangerous complication of diabetes. Because of high blood pressure and poor glucose control, your kidneys can fail. So that prevents you from filtering out waste products. And the waste products build up and can elicit their own symptoms. Kidney failure is most likely due to genetics, your glucose control, and your blood pressure. ACE inhibitors are very commonly used for people with diabetes who also have high blood pressure. It's also a very common high blood pressure medication. But it even shows that if you don't have high blood pressures, that ACE inhibitors may be helpful in preventing kidney disease in people with diabetes. So why would you need an anti-seizure drug for diabetes? Well, it turns out that anything that treats neurological conditions for other reasons, like epilepsy, can also be used to calm down the nerves if they're afflicted due to diabetes. So Lyrica, Neurontin, carbamazepine are frequent anti-seizure drugs to counter neuropathies. Antidepressants have also shown some benefit in treating neuropathies, as have the newer antidepressants, the SNRIs and Cymbalta. Of course, any drug that you would be prescribed can have some side effects. So make sure you let your doctor know if you're put on a new drug, if you start to experience some unusual side effects. So what are some complications of diabetes? Well, urinary tract problems are common. You can get more bladder infections that can affect bladder function. You may have more frequent urination. You may have more pressure below your belly button. Sometimes, because you can't sense that your bladder is full, you may have to do what's called self-catheterization so that you can remove the urine. Otherwise, urine that builds up in the bladder that isn't released will make you more prone to urinary tract infections. So any GI symptoms like indigestion, belching, may be managed by just changing what you eat, how often you eat, the volume of what you eat. It's possible you may have to go to soups or pureed foods, although that is rare. There are some medications to help stimulate the gastrointestinal tract to work more effectively. Sometimes people with, nerve damage or small vessel disease can have problems where their low the blood pressure gets low when they stand up suddenly. So always be sure to be well hydrated. And whenever you get up from a sitting or lying position, that you first sit up and make sure you don't get dizzy, and then slowly go to a standing. There's some medications that can help prevent this. So there's some other medications you can use. Capation cream can be applied to the skin and can reduce the painful sensations from neuropathy. Alpha lipoic acid is an antioxidant. Almost all antioxidants would be helpful for any inflammatory condition like diabetes. There's transcutaneous electrical nerve stimulation. It delivers tiny electrical pulses to specific nerve pathways through small electrodes placed on your skin. It is considered safe, but it doesn't always work. And then there's acupuncture, which may relieve the pain of neuropathy, and it's very low on side effects. So there's alternative options out there besides medications. So what are some of the acute complications of diabetes? Well, one thing is, if you get dehydrated, it is a no-no with diabetes of any type, because that combined with elevated blood glucose can make you go into what's called a hyperosmolar state, which is a medical emergency. It just means everything in your blood is at high concentrations. So you may get thirstier, hungrier, you may urinate more, you may have neurological symptoms, headaches, tremors, nausea, vomiting, abdominal pain, weakness. Like I said, it's an emergency, and you need to be rehydrated and evaluated by medical personnel immediately, because you generally require intravenous fluid replacement and insulin. Some drugs that could cause high blood glucose are some antibiotics. So your doctor is familiar with the ones that should be avoided or doses adjusted. Beta blockers such as propranolol, metoprolol, these are usually used for cardiovascular high blood pressure patients. So those will likely be avoided or adjusted downward in dosage. Thiazide, antihypertensive drugs like hydrochlorothiazide are usually used to control blood pressure, but they may promote an elevated glucose. So although these drugs may be used in diabetes, they're generally watched more carefully so that you don't have an increase in your blood glucose despite other treatments. So of course, we know that steroids are very commonly used, and unfortunately, they can raise your blood glucose level and cause hyperglycemia, as can the calcineurin inhibitors, which are used to boost the immune system. They're commonly used in transplant patients, so they're not that common. Protease inhibitors are antiretroviral therapy for people with HIV and AIDS. Again, can result in elevated blood glucose. All right, so not only is excess glucose or hyperglycemia dangerous, so is hypoglycemia, because that means your blood glucose is too low, and that triggers the release of adrenaline, your fight or flight hormone, also known as epinephrine. And then the epinephrine is what causes the symptoms of hypoglycemia. So you have a thumping heart, sweating, tingling, anxiety. And if it continues to drop, then the brain doesn't get enough glucose and it will stop functioning. So you might experience blurred vision, difficulty concentrating, slurred speech, things like that. And if it stays too low for too long, it can lead to seizures, coma, and rarely death. So why would you have excessively low blood glucose? Well, you might be taking too much medication, such as insulin, or other medications that might lower it by inhibiting the release of glucose from the liver. Maybe you're eating less than usual. Maybe you're out and about expending more energy. So you can have, mild symptoms from like feeling shaky or nervous, or you can start feeling like you're, getting pale, feeling sleepy or weak. And if you start getting numbness of your lips, tongue, and cheeks, or headaches, or feel coordination problems or clumsy, you need to reach out immediately for help and make sure you get supplemented with some sort of fluid with glucose in it. This is just a list of a bunch of drugs that can impact your glucose levels. So if you happen to be on them, you will be monitored, but you should be aware if you are on them in case you experience any of the side effects or the symptoms of low blood glucose that I mentioned earlier, the previous slide. 15-15 rule. It takes 15 grams of carbohydrate to raise the blood glucose. So, and you should check it after you give that amount of carbohydrate. You should recheck the blood glucose in 15 minutes. If it's still below 70, you need to keep repeating that dosage of 15 grams of glucose until you are seeing a rise in the blood glucose level. There's tablets, there's gels, there's juice, hard candies. Remember, complex carbohydrates are not what we want. We want the simple sugars because they're fast acting. Glucagon is a hormone produced by the pancreas that causes the liver to release glucose into your bloodstream. So it is one therapy for, prolonged hypoglycemia, especially if someone's can't take something orally. This would be an injection that would be given under doctor supervision. I mean, a doctor doesn't have to give it, but it would have to be prescribed. So your friends and family members should be instructed on how to administer the injection. Usually, if the person is unconscious, then the consciousness will come back in 5 to 15 minutes. But at that time, you may experience nausea and vomiting. Whatever the case, if glucagon is ever administered outside of a healthcare setting, you need to notify your physician immediately so that they know what to do to prevent that from occurring again. So then we have another complication called diabetic ketoacidosis, known as DKA. It's very serious. It must be managed in a hospital, and you can lead to diabetic coma and death. So what happens is when the cells don't get the glucose they need for energy, okay, the blood glucose has to go into the cells in order for the cells to be able to use them. But when it doesn't do that, the body begins to burn fat as energy, which produces ketones. And ketones are chemicals in the body that break down the fat to use for energy. And the body does this when it doesn't have enough insulin to use glucose. So which is the body's normal source of energy. When the ketones build up in the blood, you become more acidic. The blood is usually not acidic or alkaline. It's right in the average of neutral. So this is a warning sign if you have acidic blood count that you are dangerously high in glucose, in ketones, I should say, because ketones acts as poison to the body. It's rare in people with type 2 diabetes, but it can happen, especially in unusual circumstances such as infections or missed insulin doses and other stressors to the body. It usually develops slowly. You can start vomiting, which makes the matters even worse. So if you're very thirsty with a very dry mouth and you're still having high blood glucoses and frequent urination, and you have high ketones in your urine, that's very dangerous. You need to notify your doctor. As we said, there's other symptoms. Your whole body is affected by this. It's dangerous. It's serious. Any unusual change in your, cognition, your ability to walk, being confused, should always alert you to the possibility of DKA. You need to go immediately to the hospital or dial 911. Ketones can be measured in a urine test strip. So what will happen in the hospital is your urine will be measured, your blood will be measured approximately every 4 to 6 hours, maybe more frequently. If you're at home and you're showing high level of ketones in your urine, you need to tell your doctor so they can advise you accordingly. And do not exercise when you have high ketones and your blood glucose is high. You need to get medical management. So here are the 3 basic reasons for moderate to large amounts of ketones. One is you don't have enough insulin. Maybe you didn't inject enough, or your body just needs more for some particular reason, such as an illness. Not enough food, like when you're sick, you don't feel like eating, so that could raise your ketone levels. so it's best not to try to miss a meal. You can have an insulin reaction, which means you've had a big drop in your blood glucose. So if testing shows high ketone levels in the morning, you may have had an insulin reaction while you were asleep and didn't know it. The complications include swelling of the brain. Your heart could stop working because of all the poisons in your blood. And of course, kidney failure could happen as well. The goal of treatment is to get you hydrated, so IV fluids, testing for ketones, managing your blood glucose. All of this must be done primarily in the intensive care unit in the hospital. Basically, I talked about fluid replacement, but electrolyte replacement, things like sodium, potassium, chloride, all of those get all out of whack and DKA, so those need to be supplemented, or if they're abnormally high, fixed as well. And as again, insulin is the primary treatment to get the blood glucose down and reverse the ketosis. The management of type 2 diabetes, as we spoke about, is healthier eating with high fiber, complex carbohydrates, weight loss, regular exercise, possibly diabetes medication or insulin therapy. And of course, you'll probably be required to test your blood glucose from time to time. Sometimes that's a schedule of 2 to 4 times a day until the doctor can get your glucose under adequate control. It's surprising, but you don't have to lose that much weight. Just 5 to 10% of your body weight can make a big difference. The best way to do any sort of weight loss is to do it gradually. Weight gain is gradual, so weight loss should be gradual as well. Makes it more sustainable and more likely to be able to be maintained if you do it gradually and under the supervision of a healthcare professional. Of course, fewer calories matter. I think, we've gradually over our lifetimes seen larger and larger portions. And so we just really need to eat less of them. And the best way to eat less of them is to eat slowly, to drink water in between each bite, to put your fork down in between each bite, to chew completely. And if you eat slower, then you will get full faster and you will not want to continue to eat. When people eat fast, they tend to overeat and take in more calories. And fiber is great at feeling more full. So that would be important to consider. And as usual, a dietitian can be a very good resource, essential resource for people suffering from diabetes. Okay, so you don't have to go and start going crazy on the physical activity. Number one, if you haven't been exercising, you want to start slow and build up. But just getting out and walking for 30 minutes a day and build up to make it brisker is very important. But, swimming, yoga, anything that gets you moving is going to help you lose weight. And it's been shown, even if you didn't have diabetes, that is important for longevity. And depending on what kind of medication you're on or what your treatment plan is, you're probably going to have to check your blood glucose, at least in the morning, and then sometimes before or after meals throughout the day. It all depends on how long you've had it, what your sugars have been in the past. But once you get in a good treatment plan, then you'll probably be able to cut back on how often you have to monitor your sugars. But initially, when you first start treatment, you're going to have to monitor it more frequently. So basically, as we stated, there's lots of medications. Only time you would add insulin is if, one or more medications failed to control the diabetes. So let's talk about metformin. It's one of the most commonly first prescribed therapies for type 2 diabetes. And it works by lowering the glucose production in the liver and improves your body's sensitivity to insulin so that the body uses your own insulin that you produce more effectively. There are some side effects. So, you need to be monitored if you get put on those. And you may need to be supplemented with B12, vitamin B12. Sulfonylureas help your body secrete more insulin. Diabeta glucanase, glucotrol are some of them. The other medications are meglitinides, such as Prandin and Starlix. They work by stimulating the pancreas to secrete more insulin. They tend to be faster acting, but their duration in the body is shorter. These kind of medications like Avandia and Actos make the body's tissues more sensitive to insulin. They have been linked to weight gain and other serious side effects. Again, your doctor will start with the more commonly prescribed before adding any additional medications or changing you altogether. The DPP-4 inhibitors is easier to say, so I said it. Januvia and Ungliza and Trajenta help reduce blood sugar levels, but they don't have, a great effect. They have, a modest effect, and they can cause other problems. The GLP-1 receptor agonists are injectable medications that slow digestion. Because digestion is slowed, that will limit your blood glucose level over time. Byetta, Victoza, Ozempic are some examples of those. There are also the SGLT2 inhibitors. They prevent the kidneys from resorbing sugar into the blood, so they allow you to excrete more in the urine. And they may also have a benefit of reducing heart attack and stroke in some of the people who are at high risk for these conditions. Acarbose is an alpha glucosidase inhibitor. It is used as an adjunct to diet and exercise to improve glycemic control in people with type 2 diabetes. There's contraindication, so it won't likely be used unless you've been having trouble with other medications. In fact, it can affect your liver and cause the transaminases are liver enzymes, and the bilirubin is also from the liver. So that would be monitored frequently if you were placed on that medication. And it can cause low blood sugar, so that needs to be watched. So again, this would not be prescribed as first-line therapy. So consult your doctor if you have questions. So sometimes people with type 2 diabetes do need insulin. Usually that's in conjunction with an oral medication. Unfortunately, insulin cannot be taken by mouth. It must be injected. There's different types of insulin, and they work in different ways, and they also have a different speed of onset and how long they last in the system. And here's a list of them. There's quite a few. So as you can see, the rapid acting can take effect within 15 minutes. Short or regular are pretty fast acting too, within 30 minutes. Intermediate are 2 to 4 hours in onset, and long acting may take several hours to reach peak efficiency. And then there's ultra long acting and inhaled insulin. So it shows you the peak time to when they reach their highest levels, which should correspond closely with a decrease in your glucose levels. They can last, 2 to 4 hours, 12 to 18 hours, sometimes 24 hours and longer. You usually will be placed on a combination of these, depending on what your fasting glucose levels are compared to your 1 hour or 2 hour levels after a meal. What are some other things? Some herbs that might impact your medications that you take for diabetes. Aloe vera, increased efficacy of these two drugs. So I'm not sure if that's a problem. You need to talk to your doctor about that. Andrographis paniculate probably increases the efficacy of a few of these drugs listed. Ginseng probably actually decrease the efficacy of your drug. So I wouldn't go on ginseng without talking to your doctor. And Chlorella may increase the efficacy as well. So if you decide to start any of these herbs or use any of these herbs, you need to let your doctor know so that they can monitor for any, changes in your blood glucose that might be not on the good end of things. Lycium, St. John's wort, herbs, and with glucosamines. Glucosamines are often used as joint supplements. Herbs with isoflavones. A lot of these are oxidants as well. So just keep a list of these. Make sure when you take a supplement that you read the ingredients carefully and consult with your doctor. Of course, alcohol we can talk about alcohol and ethanol. Alcohol intake can lead to prolonged hypoglycemia. Any medication for diabetes can lead to either low blood glucose or not work well enough, and thus you're still having high blood glucose. So it's just best to check your blood glucose so that we know what to do with your medication, and to be honest with your doctor so they know if you've had a few alcohol drinks, which should be avoided if you have diabetes. A lot of this information is, highly technical, but your doctor will know what to do if you're having some of these problems. Metformin, there is one problem that, warrants stating, and that is if you have to have some sort of radiological test that requires contrast media, you would have an increased risk of damage to your kidneys. So there may be some pre-medications they can use to decrease that risk. Cimetidine is a common antacid, so that can increase your levels, so be careful with that. Same way with, ibuprofen and NSAIDs. You need to be very careful that you talk to your doctor before adding any over-the-counter remedies that you're not sure about. A lot of these things are so complicated that I don't think it's clinically relevant for me to talk about, but the information's here for your consultation. It will be available on the website if you'd like to learn more about individual drugs and what they might interact with or what they could cause as an adverse effect. As you can see, combinations might be a problem with causing kidney or liver dysfunction. Metformin can cause lactic acidosis, which can be serious and could require hospitalization. Some other medications might cause you to retain fluid, which could lead to a buildup in the heart and the lungs. So it's just important that any unusual signs or symptoms be reported to your healthcare provider. Thank you so much for watching this session. I hope it was insightful. Follow us on CCM Health social media and visit our website to learn more.